Dr. Ryu. Dr. Ryu Sang-hyo is here. Good morning.
Good morning.
How are you?
Oh, it's great. The weather is perfect. It's from my point of view.
Oh, I love the weather as
I
well.
love this kind of weather. It's
Yes.
perfect for reading.
Reading.
Yes. 독서의
Yes.
계절.
맞아요. 근데 it's definitely fall. They say is like the season for reading, like cozying up with a nice book, nice warm fuzzy blanket, warm cup of tea.
Yeah.
It's so perfect.
Yeah, but I
Yes.
stick to my New Year's resolution.
Ah.
Just one book a month.
Okay, I was going to say a
Yeah.
year.
Not a year.
Because I
One book a
imagine you're
month.
reading a lot. So
One
yes.
book a month because
Oh.
my kids goes. She is he not.
I was like, I thought you had a son.
he is elementary school, and then we read book together. So I used to read an adult novel. These days I read his novel.
Oh,
it's very
together.
fun. Yeah, together.
Such a good dad. I have a text
Okay.
topic.
Yes.
Oh, actually, do I need to ask Dr. Ryu? Maybe. We're talking about like loans, like whether it's student loans or mortgage loans, or you don't have to get too personal, but, have you ever taken out a loan? It's related to one of our other topics.
Of course, my asset is my bank account, and I think all those bank in Korea are my asset. I would say.
Oh.
Yes. Yeah.
I like that thinking.
Yeah. So borrowing
크게
money.
생각하시네요.
Yeah, that's right. Yeah, the minus that is my property.
Oh, minus.
Yeah, the more you have that, the more you have the more you have your property.
Oh, the more.
Yeah, the first I borrowed money from
Yes.
bank is when I was in college. You know, I was considered as like a recipient of government assistance
Yes.
welfare because my social situation wasn't very good. So I got the loan from bank and also from government for living assistance for scholarship. I got that because for the low income families.
Yes. I'm proud of it because it made you who you are today. So
That's right.
Right.
Yeah.
All right. We are going to dive into our main topic for Ask Dr. Ryu. What is it today?
Today's topic is about national screening health system. 검진 막 가잖아요, 지금쯤에. 여러분, 지금 가면 안 돼요.
지금 가면 안 돼요?
Because 가면 되긴 되는데요. The more during winter season towards the end of every year.
There's a mad rush, right?
Yes, mad rush. The doctors and nurses and the medical personnel might be a little bit hasty, so a lot of people are flocking to the screening tenders. And then it means that some kind of a misstep might happen. I hope not happen. Not gonna would, but
Yes.
So
You're making me nervous because my sister signed me up. I think I'm going first week in November. She signed me up a few weeks ago, and then she's like, "Oh, I need your appointments on like November something." I was like, "Oh, it is? Okay, thank you."
please get it done as soon as possible. It's not
okay.
gonna get crowded as much as it would be in 2 months.
Yes. All right. So, what is the whole idea about this, like the national screenings? What's the main goal, the aim?
The idea is simple: catching potential disease before they cause symptoms.
Yes.
Prevent complications before they become irreversible. We could say it's a curious way of shifting healthcare focus from treatment to prevention.
Yes.
Think of this way: the best bang for your buck, or the biggest benefits you get out of your screening test is early detection.
Yes.
So early detection means less painful, easy treatment, and then the better quality of life if you get a treatment properly.
Yes. And so, to me, it makes perfect sense. Better to prevent than to treat. And it does sound like the national screenings are offered to every single Korean citizen, plus for those who qualify, foreign residents as well. If you especially if you're gainfully employed, I'm thinking you do qualify. I'm going through my employer as well, the employer insurance. It sounds like a safety net, basically, for the entire population.
Exactly. So in neurology, we often say time loss is brain loss. As a neurologist seeing many stroke patients, I can totally relate to that. Time lost, brain lost. Time lost is your life lost.
Oh,
Yeah.
I like that. It's like a rap almost. Time loss is brain loss. Okay, so let's go through the logistics. What actually happens during a screening? Because, people, I know people who are full adults that kind of skip the national screenings because they're scared. They don't know. They hear about the endless vials. There are lots of vials, so I've noticed. But they don't poke you every time, right?
No.
They poke you once, and then they change the vials,
yeah.
right? Yes.
And also, they might need your urine. Sample.
Urine sample. Not pain. That's pretty painless.
No, it's not painless at all.
Yeah.
And then it's not as scary as it sounds. First of all, the basic screen test takes less than an hour. Okay. First, they might check your height, body weight, and body mass index and blood pressure.
Okay.
And then X-ray. X-ray, just standing in front of some kind of a machine, and then not pain at all. And also, blood test includes screening for diabetes and cholesterol, and also you're checking your liver function, kidney function, and urine test, and dental exam.
Yes.
Not rectal exam. No scary at all.
Right. Right. Yeah. We have a question for you. It's very much related. It says, Tommy says, 류 선생님 질문요. 어떤 항목을 검사해야 할지 매년 고민인데요. 뭔지도 모르고 받는 게 대부분인데요. 라고. So he wants to know, specifically, what should he be getting tested for?
I think this question comes from Korea's easy access to medical stuff and medical approach, because that means it doesn't, the Tommy says, doesn't include the national health screening test. So some companies or some private owned screening test centers, they offer sometimes redundant, I would say.
Redundant.
Sometimes a little bit unnecessary.
Yes.
But it can be necessary. It depends. Some tests. So they might make profit out of it. But sometimes it can be very beneficial for patients, because if they detect a certain disease earlier at its earlier stage.
Sure.
So, in that case, I want to come to nearby primary physician clinic center, and then I wanted to talk about it with your primary care physician.
Yes, and so let's talk about the changes as we get older, because if you can walk us through what to expect, according to which decade of life. For example, 20s and 30s, relatively young, we think, relatively, not all, but relatively healthy, right? So
that's right.
What are they screening for?
Yeah, remember this one. When you hit the age of 19,
yes.
And then your body cells are downhill.
Why are you trying to depress us?
I mean, our cells are growing and then growing until you hit 19 years old, and after that, your cells start to getting older.
Yes.
So anyhow, that doesn't mean that you're gonna get sick sooner or later, because you're in your 20s is your prime time in your life.
Yes.
So in that case, the screening test goal is building awareness.
Okay.
So you may feel healthy, but when you have some silent problems like high cholesterol or high blood pressure.
Yes.
So in that case, doctors some just regular checkup like body weight, and then that's all height and things like that, and then counseling. And also these days here in Korea, among 20s, mental health issues play a big problem because there are a lot of stress. Like burnout can be common in this age group. So awareness and mental health screening is the one that screening tools included in the age group of 20 and 30.
Yes, okay.
In 40s, and then cancer screening, because in 40s, your cell might experience some kind of unwanted cancer. So especially the stomach cancer for young for 40s and women. You know what's the number 1, 2 cancer here in Korea? Number 1 and 2 cancer among women in their 40s.
I'm assuming one is breast cancer.
Yeah, that's right.
Okay, what's the other one?
Thyroid cancer.
Thyroid.
Yeah. Yeah, but thyroid cancer is not included because I'm gonna go over this sooner or later. Okay. And anyway, in their 40s, stomach cancer for everyone, and also cervical cancer for women, because this is the first sexual intercourse rate has decreased a little lower, so that's why they might have a chance of having multiple sexual partners. That's why they might have this kind of cancer.
Okay.
Yeah, and also hepatitis B and C screening. And when you hit 50, and then we're gonna do screening colon cancer. Oh, one of my patient friends, actually, she is very intelligent and she's a great pathologist. She died of colon cancer several years back, and she skipped this kind of a screening test. It was a big loss. I cried a lot. Anyhow,
So is colon cancer like 대장암?
대장암. Yeah,
right.
It's totally preventable. Yeah.
I see.
And also, when you hit
60s.
60s, in that case, your bone and brain health might be a big issue. So, doctors perform bone density testing for osteoporosis,
Especially for women, right?
That's especially for women.
Yes.
Yeah. And also, when you hit 65, we do some kind of cognitive function test.
Oh, really?
Yeah. And also, depression is a big issue. 우울증. 치매 이런 것들 이런 거 할 수 있죠.
So it might be all interconnected, and it has definitely, as you get older, it might be more prevalent, right?
That's
so
right.
they screen for that.
Yes.
Okay. And then if we skip to the screening versus diagnostic testing. So if you can at least school us a little bit about the sensitivity and the specificity of some of these tests. What are we talking about?
Okay, if you really want to understand the concept of screening tests, you got to know the concept of sensitivity and specificity.
Yes.
First of all, sensitivity means 민감도.
Oh, okay.
민감도. It's how good the test is how good the test is at detecting people who really have the disease or not.
I see. And also, hopefully, the early stages.
The early stages.
Yes, okay.
And also specificity is, on the other hand, is how good the test is likely at reassuring that person doesn't have any disease.
Yes.
Let me give an example. You know, when you go through, when you get on a airport,
yes,
you have to go through some kind of metal detector, and then you gotta take off your clothes and then put them in a basket, and then have them go through some X-ray machine, and then you gotta pass through some kind of a gate.
Yes.
And then
metal detector.
Yeah, metal detector. Yeah. If the metal detector has a high sensitivity, a small tiny bit of a metal attached to your body might ring a bell.
Sure.
But if the metal detector has very high specificity, in that case, it only gives off its alarm when when it really detects some dangerous pistol or something like that.
Okay, so even though you might have a metal pin somewhere in your body,
no, it's not.
It's not going to go off.
Got
it.
Off.
Okay, that's a great example.
Yeah.
So if you go through the standard testing, and then when someone gets like an abnormal notice, I'm sure that's kind of scary. What happens next?
What happens is, it doesn't mean that you are sick. It doesn't mean that you are diagnosed with some kind of disease. It's just a warning. So in that case, I wanted to go to some other further confirmatory test.
Okay.
So it's not gonna make you panicky. So in that case, further test is needed.
Okay.
So it's the purpose of the screen test. The better, the early detection saves your time and saves your money and saves your life. So don't go panic. So that's why I wanted to go to a physician or related doctors.
Yes.
The test recommended.
Yes, and I do want to touch upon some of the cancers that escape the routine cancer screening. You already mentioned thyroid cancer. So that's one. What are some of the other ones that are not screened?
Yeah, pancreatic cancer is 췌장암.
Yes.
Yeah, because there's no specific biomarkers available. There are some biomarkers, but it's not cost-benefit effective. And also, if you find it earlier, it's already detrimental.
Right.
And also, ovarian cancer is another one.
For
and
women.
also, it's a vaginal cancer, 식도암, because the reason it's excluded is when you do endoscopy done on your stomach, the endoscopy fibrous optic lens goes has to go through your esophagus that
Yes.
it can detect with easily. So it doesn't include. It's not included in the national. And the kidney cancer is pretty rare. So and a brain cancer, because in order to detect brain cancer, doctors have to order any PET scans. Or PET scan, it gives off a lot of
Yes.
radiation.
Sure.
And if you perform MRI scanning, the cost will be enormous.
Right.
And so that's why you have the self awareness of your body is the
Yes.
most important thing in when it comes to maintain your healthy lifestyle, maintain your health.
That's right.
Yeah.
So you gave us such a wealth of great information today. So as we wrap up, what do you want to leave us with today?
Okay. Sometimes have that. I don't have much time. I don't have. I'm really scared, but don't be scared. If it's just checking just one poke, and that's all. And then it's gonna get done. You're gonna get it done in less than an hour. And then, I'll give you this one. 1 ounce of prevention is worth of a pound of cure.
Ooh, I like that.
So
From Benjamin Franklin, right?
Yeah, Benjamin Franklin. Right, that's right. The prevention is the best medicine.
All right. Well, let's keep that in mind. And next time, let's do it earlier on in the year. But if you haven't gotten your screening done, still get it done. That's the best
right.
thing. Yes.
올해 안 했으면 내년 또 할 수 있으니까요. 예, don't be hasty.
Yes.
Yeah.
All right. Well, thank you so much for this plethora of great information, and we'll check in with you next week. Thank you, Dr. Ryu.
Thank you.
All right, everybody.